Hello, good evening.
Hi, Dr. Ng.
Hi there. Hey, Steve, please call me Warren.
Okay, I'll do that.
Okay, thanks.
Shoot. Okay, Paola, how are we doing on committee members? I got Tanya. I got Jay Meza. I got Sally Fisher, and I got Wendy Painter. Hey, I'll be right back. All right, so Jay. Jay, Wendy, Sally. Um, All right, Tanya, you're co-host. You know that?
I know it now. Hi, Steve. How you doing?
Okay.
You okay?
Yeah, sure.
You okay? Okay, cool.
Yeah, well, I probably have been better. Yes, I'm okay. Okay, so we have 5 committee members, but if there's no objection, we'll wait a few more minutes and see if we round up some more people.
Sounds good.
Oh gosh. Well, Warren, how many times do you figure you've been to our committee meetings?
I don't know, but it's always a pleasure.
Well, let's not go overboard. But I gotta believe it's maybe 4 times, right? Yeah, you're definitely a repeat.
Oh, thank you. Well, hopefully I'm helpful in some way. So I think because I get to see you also at the Northern Manhattan sometimes when you've come to that meeting as well. So
Yeah, well, this is my regular hangout.
yeah.
I only show up when at those other meetings when I can break away from my job.
Well, your job keeps you busy then.
Yeah, sure. All right. Sally is dressed up with her usual crown of flowers.
And a monarch butterfly.
Oh, yes. Well, but the monarch butterfly is flying around you.
Yep.
Oh, shoot.
Steve, you have quorum. Other community board members have joined.
Okay. Who else do we have?
You have Catherine and you have Mary.
Mary Anderson. All right, great. All right, so, oh, good. Catherine is also a co-host. We got plenty of co-hosts today. And Mary Anderson, great. All right, so, 3, 4, 5, all right, so we have 6 of our 9 members. That's 2/3, not bad. It's better than the Democrats can do in the Senate. So let's call the meeting to order at 6:41. We have our usual agenda crammed with different things. We have I have a tentative commitment from the Vice President of Langen Engineering, which is the consultant working on the brownfield cleanup plan for 4650 Broadway. He said he would try to come tonight, but he also said if he didn't make it tonight, he would have a better chance of coming to our March meeting. Let's see how that pans out. And instead of Pauline Ferrante from the Health Department, tonight we're expecting Padmore John, who has been to our meetings in the past. So let's get started with Warren Y.K. Ng, MD, MPH. He's got like 3 different titles: Medical Director of the Outpatient for Outpatient Behavioral Health at the New York Presbyterian, Columbia University Medical Center, Director of Clinical Services, Child and Adolescent Psychiatry, and a Professor of Psychiatry at the Columbia University Medical Center. He wants to be called Warren, so we'll do that for him, make him feel at home. He's been to our committee meetings, I believe at least this may be his 4th appearance, so he's evidently doing fairly well. We keep inviting him back. And what Warren, as you probably know, we have a special interest in the state of the psychiatric service at the hospital. Some of it stemming from our concern over the closing of the inpatient beds at the Allen Hospital. And I know that you don't deal with the inpatient side, but I'm still hoping that you can speak to it to some degree. You know, I did forward some questions in advance, so I'm hoping that you might have been able to get some answers for us. But I have to say that I have read probably 5 or 6 different articles lately concerning the mentally ill and the homeless, and especially in the aftermath of the Michelle Gull being shoved into a subway tracks and being run over by a train by a guy who is obviously mentally ill, and then the 2 recent killings of our police officers in Harlem, and I keep reading columns that talk about the need for psychiatric beds, but apparently both short-term and long-term. So the more I read, the more I'm convinced that our position is correct, that it's a mistake on the part of the hospital to close those beds and to also close other beds at Brooklyn Methodist. But Warren, let me not hit you over the head with that. But I really think the hospital is doing a disservice by not at least committing itself to reopening those beds at the earliest possible opportunity. But let me hand it over to you, and let's hear how you've been able to handle what I assume is a crisis in psychiatric care during the pandemic.
Thanks, Steve. And I know that, and thank you to the Community Board 12 for all of your work. And it's great to be able to be here to help try to answer some of the questions. And I think, as you're saying, Steve, I think thank you so much for your leadership, particularly during the hardest times, because I feel like this pandemic has definitely stressed and stretched all of our abilities to do things. And unfortunately, there's been a tremendous toll on mental health, behavioral health, addictive disorders across the board. And that's definitely something that we've seen nationally and regionally. And I think it really speaks to levels of care and the need for behavioral health services also across the entire continuum, because we definitely want to take care of people when they're at their sickest, but we also want to be able to prevent the next crisis or the next problem from becoming more difficult. And so I think that those things are all really important in creating a larger system of care. So should I go with some of the questions that you had shared with me so I can go through them? Would that be most helpful?
Yeah, that's fine by me. But don't assume that that's the full extent of the questions.
Okay. Well, that's the beauty of the board. So I totally celebrate that. And so one of the questions is, what was happening with the patients who had been admitted to the Allen Psychiatric Inpatient Unit? Are they going to Gracie Square or Westchester? And so I think the important thing here is that from the hospital perspective, I'm also representing my wonderful colleagues and team members who work in the emergency department and inpatient services. And I don't have that privilege to be in those settings. I oversee the child settings, but not necessarily the adult ED and inpatient services. So I'm going to speak from their experience and what they shared with me. So, but it is always the goal of the hospital to make sure that patients are admitted or individuals receive the right psychiatric care in the right place within the New York Presbyterian system of care. So as you know, NYP is an enterprise with different resources in different campuses. And part of that is to respect also the needs of the patient, whether or not they have additional medical needs, preferences or diagnosis or factors. So the thing is that for the patients that would have gone to the Allen Hospital, the majority of them are still going to the places where they would be admitted, particularly through our emergency department. So that would be Gracie Square as well as New York Presbyterian, Westchester. So those are the two locations that are often used, in addition to Milstein 9 Garden North. So there's also our 24-bed inpatient unit at the Milstein Hospital. And that's particularly important, especially with patients who have comorbid medical issues. And it's important for them to receive both levels of care. The other thing is that it's important to know that for the New York Presbyterian Hospital system, the majority of the inpatient behavioral health patients have always been provided care at Gracie Square and the New York Presbyterian Westchester Division. because those are also designated behavioral health facilities. So that's their area of specialty and an area of kind of providing the best care. And also the idea that, especially with the Allen Hospital, the plan had been and continues to be to also provide access for patients within the community that need care for COVID-19, which was essentially the reason that unit had been converted for that purpose. So, so that was I know one of the questions that you had asked. I can go to the next question, which was, are psychiatric patients that are seen at New York Presbyterian Hospital referred to Harlem Hospital? So I'd asked my colleagues, Dr. Lawrence and Dr. Arkow in the emergency, and no patients are transferred there. So we don't transfer patients to Harlem Hospital. And as you know, Harlem Hospital is a part of our New York City Health and Hospitals Corporation. So I think that that's a different network of care, even though different institutions, and we are part of the New York Presbyterian Hospital network of care. The next question is, has the number of psychiatric patients during the COVID-19 pandemic increased, and how is it compared to pre-COVID? And so from my colleagues, they had shared that actually the numbers have been pretty consistent. Aside from the initial period of like March 2020, where it was a total lockdown and people were not going out, that time there was definitely a dip in ED visits across the board for all reasons. But I would say since that time, at least the numbers that they were seeing have been consistent to pre-COVID. And so there's been about the same volume that we've seen. There's also a question about how serious are their conditions compared to pre-COVID patients, I think pre-COVID era patients. And so there's really been no change, or at least no significant change pre or post-COVID in terms of the seriousness of the conditions. But as you're also sharing, Steve, I mean, there is a mental health pandemic. So I think we're definitely seeing greater need for behavioral health services, I think, across the board. And that's shared with our community partners as well, and what they're experiencing. And then there was also a question about how long are patients staying in the emergency department before being admitted or brought to another hospital. And the thing is that especially with emergency departments, as you may know, it varies in the day that you actually get there. So I think that there's generally, weekends are not the best times, just because generally, as we know, I think sometimes discharges occur more towards the weekdays. And so I think that there's variability based on the day and other factors based on their medical illness or complexity or any other additional things that need to be sort of cared for in the emergency department. And then I think the last question that you had shared was how many psychiatric beds are available at Milstein and at Choney? So there are 24 beds available at Milstein 9 Garden North, and we've never had any inpatient child beds at Choney. So that hasn't changed. So the child and adolescent psychiatric inpatient units that we have within the NYP system are at the Westchester campus. So, and they've definitely been a wonderful resource, particularly for kids who need inpatient hospitalization for safety and for care.
Yeah, I don't know. I don't know if Julio has joined us yet.
Yes, I see him. I see Julio. Hey, Julio.
I'm here.
Oh, very good. All right, I just sent you a text. You can ignore it. Didn't you tell us recently that Presbyterian was opening up some child psych beds?
Yes. So they added an additional 5 adolescent beds at the NYP Westchester campus, since they're licensed to treat kids and adolescents in an inpatient setting at that site. So, which has been really incredibly helpful. So I would say that that's been really important. And I think one of the things that has also been challenging, I know for the inpatient units, is sometimes it's hard for them to discharge kids because a lot of the community outpatient providers, they're just so busy. So I think that that's the other part of the larger issue about, expanding and addressing the mental health issues throughout the community.
Right, so there are 5 child psych beds at Westchester. Is that right?
5 additional.
But not a total of 5?
Oh, no. I think that there's 2 units. There's a child unit and an adolescent inpatient unit. So each one over 10 in terms of the number of beds. But for some reason, I don't have those exact numbers with me right now. But there are two full units, and then they had additional beds so that they could address the adolescent needs because we were seeing more adolescent.
You are seeing more adolescents.
In general, I think that it skews towards adolescence in terms of especially emergence of behavioral health issues with adolescence and puberty, and that's a natural history for anxiety and mood disorders to start.
And as I understand it, there's been a huge increase in suicide visits for female adolescents.
Right, you beat me to the next question. This is Sally Fisher, so it is. That was also my sense. So, Warren, is that the case that you are seeing more adolescent females who are maybe attempting suicide?
Thanks, Steve and Sally. That is a CDC study that was looking nationally at the increase in adolescent suicidal presentations in the emergency room compared in 2021 compared to 2019. And there was a 51% increase in adolescent females and a 4% increase in adolescent males. So I think that the most common presentation, I think, when we see adolescents in the emergency room really relate to self-harm and safety. So that's consistent with why young people need to be safe. That's one of the reasons why we've really expanded our really more intensive outpatient programs that are related to suicidal behavior. So we've really worked hard at developing what we call the dialectical behavior therapy program, the DBT program, which is really an evidence-based mental health treatment for suicidal youth and teens. And so that's been a really important part of our program that's been very busy. The other thing that we've done is that we've also partnered with Metropolitan Center for Mental Health in really providing more intensive outpatient treatment through an adolescent IOP, intensive outpatient program that is in that model of DBT, which is to address sort of those concerns related to suicide and treatment. So I would say that's a really important part of our model of care, is to try to make sure that young people are safe. And we can definitely see that suicide is a concern and has always been, I think, for particularly in adolescents.
The CDC study showed a 51% increase in suicidal females, adolescent females, in just a 2-year period between 2019.
It was 2021 compared to 2019. So it was compared to before the pandemic.
Yeah.
Two time points.
But in just that 2-year period. Wow.
Well, I think even even before the pandemic, suicide is the second leading cause of death for young people, 10 to 24. And that was before the pandemic. So I think that that's understanding that those statistics really speak to the need for really the services that we're trying to provide.
I have a couple questions, Steve.
Yeah, yeah, go ahead. But oh, I see, and Tanya too. Yeah, go. Well, let me turn to Tanya, and then I'll come back to you, Sally.
Okay, thanks.
Tanya.
Yes, thank you. I'm sorry, apologies for any noise in the background. I wanted to say one of the things is that I usually struggle with when people have these conversations. It's like, I want to talk about the whole person, right? So yes, there are lack of beds. Yes, we have, lack of resources, but I would like to learn a little bit more about some of the causes of the things that put pressure on people where it sort of contributes to increased decline in mental health, where we're looking at some of the external environmental factors. And there seems to be little, talked about that, where we're talking about beds and we're talking about that stuff, but we're not talking about the environmental factors that contribute to some of this. Even with suicide, there are some large issues. We had a Miss Universe, a Black woman who jumped off a building and killed herself. Prior to that, just a few weeks before that, there was a famous Black actress's son who killed himself, committed suicide. And so I would like to learn a bit more about how the psychiatric community is and how hospitals are engaging in looking at the whole person and including the environmental factors that contribute to these issues, and just not have a conversation about beds and lack of beds and things like that, because you can have all the beds in the world, but we don't deal with the problems that are exacerbating these issues. There are not going to be enough beds in the world to serve people. So yeah, I don't know if you can speak to that. And again, thank you so much for joining us. I appreciate it. And thank you, Steve, for bringing this great person in to sort of educate us a little bit more. So whatever you can say about that, Doctor, I would really appreciate it. Any comments or what can be done to address that?
Thanks so much. I really appreciate that. And please call me Warren. I think the idea, I love the perspective of person-centered care, the whole person, the family, the community, because that's really where I think, we want to center care. So one of the things that I totally agree with you is that it's not about the beds, it's about the people. And when you thinking about suicide is really, it's not a straightforward, depression equals suicide or mental illness from one definition equals suicide. It's really a host of different contributors that lead to someone acting in a way to endanger their life or their well-being, or to take their life, which I think is the ultimate tragedy. And there's a wonderful sort of initiative in New York State, which is zero harm and zero suicide. So, and I think that that's a really important goal. We should not accept anybody taking their lives, and that there are always options. There is also the New York State Suicide Prevention Resource Network, which is sort of online. It's a part of the OMH, Office of Mental Health initiatives. And that's really providing more resources and looking at screening. How can we think about asking the right questions? And that's been a really important part of suicide prevention, and utilizing questions and tools, because there's always this myth that if we talk about it, people will think about it. But the chances are people are already thinking about it, but if we don't ask about it, we can't intervene and we can't help, and they'd feel isolated and alone. And I think that that's really important part of understanding what's going on with that person, and particularly with young people. And you definitely pointed out, I think, the celebrity and the people who have media attention in terms of drawing light to this really tragic situation. But it's so important to understand what contributes to that. Sometimes it is untreated mental health issues. Sometimes it's substance use and other sort of substances that might alter or affect someone's behavior, it might have to do with trauma. And there's a lot of stressors that everyone is going through during the pandemic. There's increased isolation, there's decreased socialization, and the things that people would otherwise do to enjoy or to be with their family and friends. And I think that there's a lot of really issues related to COVID-19 fear, anxiety, that really destabilizes someone's sense of well-being and safety. And then there's also the issues related to what we call the social determinants of health, which are really all the things that make life possible, like our food insecurity, like housing and immigration, and sort of, and just sort of living in terms of having an ability to take care of yourself and your family. And I think that those things, in addition to the racial reckoning within the country with systemic and structural racism and all of the things related to the experience of being a person of color or someone who feels marginalized, definitely have added to sort of additional stressors and challenges. So I think for every person who dies by suicide, there are different factors that contribute to that. We always hope that they can get help before that happens. And part of it is sometimes asking the questions. Part of it is making sure that those resources are available. The suicide hotlines, the crisis text line, and also the New York State Project Hope, as well as the NYC Well, just really utilizing all those things. And media has an impact on sort of like how someone's died by suicide and how it's covered by media. There's definitely evidence to say how that contributes to someone being more at risk. And I think that some of the barrier restrictions that have happened, like with the GW Bridge in our neighborhood, and those kind of things have been prevention strategies that are very well documented. And we have some wonderful suicide researchers here at Columbia New York State Psychiatric Institute who really contribute to all of this work. But I totally agree, we need to move upstream to think about all the things that are affecting people's well-being.
Steve, can I, one more thing? It'll be very quick. Doctor, I just wanted to say too, I think part of the issue is when we talk about beds, we talk about things like that, it just bothers me because I think a bigger problem is lack of cultural competency, lack of available people who can work with various populations and understand those different populations and the stresses that they are encountering. And when people don't have the people that they can understand, I think it's very dangerous. And I would like to have more of that conversation. How do we increase? How do we ensure better, more providers, mental health providers who can speak to all of these various experiences that you're talking about too? You know, it's the immigrant experience of someone who's just a marginalized minority in the country, whatever it is. We don't have that. It's very hard to find people who can. So, you know, how do we increase it? How do we address that? You know?
Thank you. I think that's another great question. And I think the Office of Mental Health has really embarked on a process of looking at diversity within the workforce and how to best support cultural humility, cultural competency, cultural proficiency, and learning as it relates to mental health issues. And we have to invest in the workforce. We have to have a diverse workforce. We have to have a workforce of mental health providers that speak the language, understand the culture, or the frame of perspective that the person's coming from. And we know that ethnic, racial, minoritized communities are underserved. And yet at the same time, having a provider that understands your culture or your frame of reference can be really powerful in terms of connection and receiving care. It's also really important to work collaboratively with our community and our faith-based organizations. And we have at MYP, the Bridges to Care, and really working collaboratively with our houses of worship and really understanding that wherever you're going for help, that there's a way to connect to people who can provide the type of care that you may need, and that might be mental health treatment. So thank you. I think that's such a critical component. And we know that communities of color do not have the same access to mental health treatment in that setting.
Tanya, you raise some very strong points. Thank you. But Bernard Gromman in the Q&A also raises an interesting question regarding the Miss USA and other young people. Aren't social media especially exacerbating mental health issues and suicide? He points out that Ms. Christ was very driven, was dealing with depression and a lot of hate online regarding her age and apparently being the oldest Miss USA ever. I don't know. I don't know about that.
There are ethical guidelines that speak about how media being responsible to people should, if they are reporting on the news, to do it in a way that promotes safety and would always follow with specific resources. And those guidelines are also available through like the American Foundation for Suicide Prevention, has a particular set of guidelines, and the media as an industry does as well. But that doesn't mean that media or television or newspapers are necessarily following those guidelines, but there are specific recommendations because we know that there's what they call the contagion effect. The contagion effect is depending on how you cover and share information about how someone has died tragically by suicide, it can actually spur other people to consider that whether or not it's for fame, for notoriety, for the attention, for whatever reason for that individual. And that's why these guidelines are really important. And you shouldn't be sharing the way that the person died and sort of specific to sort of highlight in a way that would promote someone who is not feeling well to consider that as not being who would consider that in terms of suicide, in terms of a behavior that there aren't other options, and there are always other options. And that's why it's really important the way that these things are covered, that we promote people getting the help they need, knowing that there are people and numbers that you can call or text in a situation to receive the help that you deserve. And then there's also social media. There's a lot of also coverage related to how social media does not at times reinforce positive self-image that can definitely lead. We've heard about cyberbullying and other forms of people feeling targeted and victimized on social media, but also the negativity and also how it affects mental health and well-being. And there was Frances Hogan, the Facebook whistleblower, and there's some really important information about how all of these things affect our mental health and well-being, and particularly young people who live a lot of their life on digital platforms, and because of the pandemic might not have as much of the social and family interaction that could really mitigate some of these risks.
Yeah, well, I think that's exactly the point that Bernard is making as well. The deleterious effects of social media and how people can be bullied and how their self-image can be torn apart. All right, Sally, did you have another question?
Yes, just going back to the emergency room for a second. How many visits do you have in the emergency room coming to CPAP, and where are those discharged? Like what percentage is going to Westchester, what percentage is going to Gracie, what percentage is staying at 168th, and what percentage is being discharged without admission, I guess?
So I would say that I don't have all of those numbers, but I would say that the pattern of discharge, the pattern of admissions and where they are going has not changed. There seems to be the same degree of people needing inpatient hospitalization. And if they would be hospitalized or need that level of care, then they would be either admitted to Milstein 9 Garden North or near Presbyterian Westchester or Gracie Square. So I don't have those exact numbers for you, but I would say that from what I was told, there hasn't been a change in terms of those sort of general patterns of inpatient discharge or
I don't know if we have the before numbers, so maybe Julio could get us those numbers for the next meeting.
Yeah.
I guess my concern with Allen is I know that at Allen, that's where you had a lot of the dual diagnosis, mental health and substance use disorder patients. So I'm particularly interested in where the patients that might have gone to Allen, where they're ending up.
Sure. So, I mean, I think that the important thing is that treating the psychiatric illness and being able to provide that level of care in an inpatient unit, there are like Milstein 9 Garden North is an inpatient unit that provides care for psychiatric as well as medical. The new Presbyterian Westchester division has a specific units that specialize in dual diagnosis. And at Gracie Square, they also have, when the psychiatric illness is a part of the substance abuse experience, you treat both. And I think in those inpatient settings, you can also receive the care. So I think that all three of those settings have been able to provide that co-occurring disorder or dual diagnosis experience for the patient.
Okay. And have you, I know it's probably pretty early, have you seen any impact from the reopening of the substance use disorder program at the Corner Project? I know they're working with physicians at New York Presbyterian.
You know, not that I have heard of, and I know that there's definitely been that community access to the Corner Project. I think at Amsterdam and 180th in that area, but I haven't heard any thing. I hear about how many lives are saved related to access to treatment and also Narcan distribution kits and how important it is for people who are at risk or are using substances to make sure that they're aware of fentanyl lacing in a lot of the opioids that people might get access to, and it's important to be able to have a prevention component. So I think availing oneself and encouraging people to get those Narcan kits as well as safety precautions is really important.
I would agree. Thank you.
Thank you. I think that was, and thank you for bringing it up because that has been the other silent pandemic during the COVID-19 pandemic is the increase in overdose deaths within the country. There is a 30% increase during the pandemic, which has been really tragic. So I think any means to prevent and provide safety and to get people care is really important. And Narcan is really important in terms of being able to distribute those to save lives for individuals and family members.
Jay Mazer has a question.
Yes, Warren, I was wondering if you could forward to Steve next month's meeting the specific numbers that Sally was requesting, because that would allow us to make a better specific sense of what's going on in the neighborhood and understand better what you're saying.
Okay, well, I can definitely request that. I think one of the things that had been shared was that there wasn't really any change in terms of that numbers overall and the places that folks who are receiving their inpatient care, but I hear your request, so point taken. Thank you.
All right, well, I can follow up and send both you and Julio an email, and I'll check with Sally to make sure that we know what it is that's being requested.
At the 168th Street campus, I know at one point there was an eating disorders clinic there. What else is being treated at that specific site?
Oh, are you possibly referring to the New York State Psychiatric Institute and the services that might be available through?
That could be over there. Sometimes I can't distinguish what's in which building.
Well, Sally, I think that's part of what's so. I think you've got these different entities in the same kind of vicinity. You have like New York Presbyterian Hospital, you have Columbia University, and you have New York State Psychiatric Institute, and you have Research Foundation for Mental Health. So I think the New York State Psychiatric Institute has also inpatient units. They have outpatient programs, and they do have particularly research-oriented programs, and they do have an eating disorders program that they are accepting referrals for individuals who would benefit from that level of care. And we've definitely seen more eating disorders during the pandemic as well. That's also increased. And then there's also this wonderful resource at the Office of Mental Health, the New York State Psychiatric Institute website related to OCD, anxiety disorders, as well as other resources that might be helpful. So I think that there's New York State Psychiatric Institute is yet another sort of wonderful psychiatric resource within the community. They also have outpatient clinics, the Audubon Clinic, as well as the Inwood Clinic, that are focused more on individuals living with severe mental illness and the care that might be beneficial.
Yeah, I know at one point they also had, and this is going back decades, I think, they also had within New York State Psychiatric Institute, they had a Washington Heights project. I'm not sure if that still exists there.
Are you talking about the Washington Heights Community Services, like in terms of their outpatient program?
I know they had an inpatient unit also at New York State Psychiatric.
They have two inpatient units at the New York State Psychiatric Institute. On the 4th floor and the 5th floor. So those are separate from New York Presbyterian Hospital, but they are in another inpatient resource for, I think, individuals coming to our emergency department, particularly if they live in the community, could be a good resource, and they are admitted there as well. So
great.
Separate from NYP, which I think is important to know the New York State Psychiatric Institute resources too.
And Steve, at some point we should have them come in because there's a wealth of research going on over at New York State Psychiatric that I think would be of interest to our community.
We had a woman who was a leading researcher at the PI, came to one of our meetings, and she was excellent.
She did a lot of work on the George Washington Bridge, actually.
Yeah, that's right.
That must have been Dr. Gould.
Maddie Gould. Maddie Gould.
Yep.
Yeah, she's wonderful. Gould.
Yeah. Gould.
Yeah.
Yes, very good.
And she is a world expert in suicide prevention, means restriction, like the George Washington Bridge. But you're also thinking about Dr. Evelyn Attia. Dr. Evelyn Attia is overseeing the New York State Psychiatric Institute services, and she's an eating disorders expert. And so if it's helpful, I don't want to volunteer her, but she's wonderful. And she oversees that whole spectrum of care of inpatient, outpatient. And they also have through New York State Psychiatric Institute, like On Track and COPE, which are the early first break psychosis programs and the young adult programs that are really important. And there's also the Clinical Practice Innovation site, which is an online wonderful resource for training and education for mental health providers, particularly in the community. So that's a wonderful resource on like great suicide prevention, suicide intervention, motivational interviewing, cultural humility, cultural competence. Really, so I encourage folks to take a look at their New York State Psychiatric Institute and OMH resources. I find it incredibly helpful.
We should, Sally, you're right. We should have them come to a committee meeting. We haven't had anyone from PI in a number of years, so it would be good to get an update. Warren, do you know how many? I asked this question at the risk of Tanya throwing something at me. Warren, do you know how many beds they have at PI?
I don't have the exact number, but it's 2 units, and generally units are, I want to say, about 10 or 12. So it's in that ballpark, but don't hold me to the exact number, but they have 2 units. So
I won't quote you. All right.
Yeah.
So I think we've covered the ground today. Appreciate your coming back to talk to us on what I think might be the 4th occasion. You're in the running now, I think, to be one of our more frequent guests. But unfortunately, you're coming back here because it's a subject that is of such importance and to the community and to this board that we have no choice but to ask you to come back and update us from time to time. And hopefully one of these days when you come back to us, we'll hear that the psych unit at Allen has been reopened. So thank you, Warren.
Thank you so much. Well, I think that your priorities are my priorities because that's what I live on. I live in mental health services and trying to provide more psychiatric care. So thank you.
Warren,
Thanks.
Thank you.
to be the truth, Warren, I would really prefer to put you out of business completely. I would really prefer that there are no people for you to treat and that you would just have to sit at home and twiddle your thumbs. But that's just not the case.
I totally agree with you. I would definitely enjoy twiddling my thumbs. So I share that. Thank you.
All right. Thank you for.
Thank you so much.
Thank you very much, Warren, for
Thank
joining
you.
us.
Thank you for taking time.
Take
with us.
care.
Bye-bye.
All right, so the next item on the agenda was to be a discussion with Michael Burke, the Vice President and Senior Associate at Langen Engineering, about the brownfield cleanup plan at 4650 Broadway. It does not appear as though he has joined us. He did, as I mentioned earlier, he did say that if he didn't make it tonight, he would try to come in March. So I'll try to pin him down for March. I did have a brief conversation with him today, and he did tell me that much of the remediation was done before the old garage building was demolished, and there was some technique that they used to somehow nullify the contaminants and not dig out all of the contaminated soil. But I wanted to hear more of that from him tonight, and I wanted him to explain it to people on the committee and in the community. So we'll shoot to get him here in March. Now, I did get somewhat of an extension from State DEC to submit some comments about the remedial work plan, and so I have a few more days before we can send something in. So if anybody has some additional points they want to raise in our comments to DEC about the remedial work plan for the site, you can get them to me, over the weekend by certainly no later than Sunday, because I'm going to try to send something in on Monday.
Steve, a quick question. 2 questions, actually. One, can we have somebody from the EC present when they are presenting this whatever new technique that does not have to dig all the soil? And can we confirm with the EC there is such thing, or any other institution, organization that can confirm that there is such thing, that they don't have to dig all the soil? That sounds like a little something I never heard of this, but then again, it may be out there, but did you or anyone else heard of such technique?
Well, I think that's a good question, which I can try to raise with DEC.
Okay, thank you. Actually, when he is coming to present next month, it will be nice if he can bring some success stories from other places that they use that technique successfully.
Yeah.
Even if it's another country.
He also would handle the remediation of the site at Amsterdam Avenue between 180th and 181st Street, and he told me that this site at 4650 Broadway was not as complicated or difficult as what he found at Amsterdam Avenue.
Okay, so it shouldn't be an issue to tell us more about this wonderful technique.
Yeah, no, I agree. I want to hear about it. All right. All right. Very good, OC. All right. So next we go into our the usual heart of our meetings for the last couple of years, dealing with updates on COVID-19, how the pandemic is affecting our community. I am expecting a representative from the Department of Health and Mental Hygiene, who's been before us before, Padmore John, Acting Assistant Commissioner for the Bureau of Harlem Neighborhood Health. I told him that we might not get to him until somewhere between 7:30 and 8 o'clock. So I would expect him to be showing up shortly. So why don't we move on? The next speaker would be Janiel Edwards, Community Affairs Associate, representing the Columbia University Irving Medical Center. Janiel, you have the floor.
Hi, good evening, everyone. It's a pleasure to see you. I'm going to turn on my camera. Give me 1 second. My report this evening is very, very brief. I just have an update for you in terms of the COVID numbers and the testing that's happening across all Columbia campuses, with some specifications regarding the medical center campus. So as of the week of January 24th, 1,491 tests were conducted, and we have 26 positive test results that were reported. Across the entire campus for the university, 8,906 tests were conducted as well over that week. This information is available at covid19.columbia.edu for public review. You can feel free to check it out and to learn more about the COVID campus protocols and any other information that you might find helpful. The second and final update is about the Medical Center Neighborhood Fund application. It's now available to all of the community-based organizations that service residents of Washington Heights, Inwood. It's an ongoing program that we've had for decades at this moment. This is the second year that the application is available online. Additionally to a PDF online application, we are accepting physical applications to be mailed in only. We're not allowing any drop-offs to the office at this time. The deadline for the Medical Center Neighborhood Fund application is February 28th at 11:59 p.m. So we've gotten some applications so far. I've sent the information over to Ebenezer to help publicize it via your mailing list. If anyone has any questions or concerns, they can feel free to get in touch with you, Steve. We'll be more than happy to follow up.
So you're going to send me something?
Yes, I have a report ready for you. Yes.
Thank you so much. All right, so any questions for Janiel?
Just a quick question. Ross is going to maybe sort of relating to the discussion we had on psychiatry. He's going to try and get us the most recent match numbers for psychiatric residents. So perhaps y'all could bring that to the next meeting.
Okay, no problem.
The most recent numbers of psych residents. Do I have that correct?
That's what I heard.
Okay, very good. All right. All right. Yeah, I think Sally asked for that last time.
Okay, Ross did not send anything to present to the board, but I'll be sure to follow up on your behalf.
Okay, very good.
Is that all? Any other questions, concerns, complaints?
I don't have anything.
Okay. All right, thank you.
Very good. All right.
Steve.
1 second. We have somebody in Q&A from the department.
Yeah, that's what I was about to tell you. Never mind. Thank you. You saw it. All right.
There's also a question from Allegra.
Yeah, 1 second. Is Ali Gumas, are you still with us? Oh, she would be in the other list. Hold on. All right, so Ali, stay with us. I'm going to call upon you when we get through with the COVID-19 reports. We definitely want to hear about composting.
That's all.
Don't go away. Allegra, is the new technique for remediation simply capping? I don't think so. I'm sorry that I didn't pay attention and take more notes, but it was something other than just capping.
I had a question for the Columbia lady. I hope she didn't sign off yet. It's hard. I have to say it's hard to flag to ask questions. Nobody watches the Q&A and nobody watches the raise your hand thing. So, yes. So Columbia had promised to do wastewater monitoring of its residence halls, and I was wondering how its surveillance testing compared to the wastewater monitoring of its residence halls, and if that had informed any modeling of prevalence in the community, whether they're doing DNA sequencing of the samples that do come up positive. Thanks.
So just to, go ahead.
Columbia had promised to do wastewater monitoring of its residence halls as a way to tell outside of its, the nasal swab surveillance system, like what the prevalence was of coronavirus. So I was wondering if anything had come of, it talked about that, but I haven't seen it published anywhere. And then Columbia has the resources to do, to do analysis to find out if there's different variants, to do the sequencing on the samples that are coming up positive. And I was wondering if they had taken that opportunity.
Thank you. Those are really good questions. I would have to follow up for you on that because I have not seen information on wastewater testing. To be perfectly honest, I haven't looked into that specifically, so I'm sure it's available somewhere. I just don't have my hands on it immediately to answer your questions.
Well, Janiel, do you think that Columbia is actually doing that monitoring?
I can't say, Steve. I would have to look into that. It's above my pay grade.
Okay.
And I think Maggie had raised that issue on a more community basis in terms of DEP doing some testing as well.
Yeah, but I think she was talking about it being done at the
residence halls, right?
No, the sewage treatment plants. I don't remember this question being directed at Columbia, for Columbia to do it at its residence halls. Maybe I'm wrong, but I don't remember that being raised.
Either way, I'm more than happy to find out more information about it. So give me a few days and I'll send something over to you, Steve, and you can share it with the rest of the community.
Okay, very good. Thank you.
Thank you.
Allegra put a link in the Q&A about that, what you explaining that Columbia was going to do the resident hall. It was going to do that testing. So it's there just so you both can see it. Just wanted to let you know.
Thank you very much.
All right, so all right, so it didn't come up. All right, so this is actually, Janiel, this is actually a Columbia publication in which there's a story that says that Columbia tests wastewater in residence halls for the coronavirus, that it's already being done.
Yeah, I opened the link and I see that there's a pilot program currently happening. But as I said, I did not have this information prior to the question coming up. So there was no way for me to verify like what the test results have been. As you know, Dr. El Sader is in the Mellman School of Public Health, and any information that we have about the studies that they're doing there, like, would have to come directly from them.
I'd like to know what the findings have been and what how they've been how they've been utilized. All right, so you'll get back to me on this.
Yes, I definitely will. Thank you so much.
Thank you. All right, thank you, Allegra. All right, so next up is Julio Batista for New York Presbyterian Hospital.
John is here now. Patmore John. Patmore John is here now.
Oh, okay.
Sorry, Patmore John.
Thank you. All right. Well, Julio, if you don't mind, I'd like to go. I'd like to bring on Padmore. Padmore.
Okay, Steve.
Thank you. All right, Padmore. Thank you for joining us.
Sure. Hi, Steve. Hi, everyone. Good evening.
All right, and you want to start with you've compiled some current statistics on the COVID situation in our area, in our 4 zip codes. Do you have those handy?
Yeah. I do. And I'm happy to share. Can you see my slide?
I do, yes.
Okay. Hi, good evening, everyone. So just briefly, as you all know, the Department of Health is continuing to capture information, just to try and get folks as much updated information as possible about where things are in terms of the case rate as well as vaccination. This is a little bit more general. Some of the recent changes that we're seeing, that just speaks to some of the case rate for various age groups in different boroughs. And we'll drill into this a little bit, but obviously to some extent, we're seeing some of these numbers are dropping, which is very positive, and we have to continue maintaining our due diligence in ensuring that, we are effectively protecting ourselves, utilizing masks, continue to be vaccinated, and isolation as much as possible when required. So just wanted to look at some of the zip codes that are over 70%. One of the key things that the Department of Health has been doing is focusing on certain zip codes that have been most badly impacted. We call some of these the 3 zip codes. And what we wanted to do is make sure that some of these zip codes at least have a 70% vaccination rate for a variety of age groups, adults, children, as well as all residents. So just wanted to show this. As you see, there are some of these are just some of the zip codes in Manhattan, but I wanted to focus on the 10032, one of the only zip codes right now in your neck of the woods that currently has vaccinated residents that have at least 70% of all residents that have been fully vaccinated. And we are considering full vaccination as 2 doses. We're not considering the booster shot as being fully vaccinated. Although we're encouraging everyone to get boosters, right now a full vaccinated is having the 2 doses of the Moderna and the Pfizer, the 1 shot of the Johnson & Johnson. So
Padmore, there are only 7 zip codes in Manhattan that that have?
No, we are focusing on very specific 3 zip codes. So these are the only zip codes of the 3 zip codes that are over. There are other zip codes that definitely have a higher percentage of all the residents, but we're just looking at very specific and basically the Lower East Side and anything north of 96th Street in the Harlem area neighborhood.
Well, I'm surprised you have zip code 13 on that list.
Yeah, so basically we just have all of the zip codes of Manhattan. These are where 70% of fully vaccinated adults. So that's a little bit different, right? So before we saw all residents, this is adults. So obviously there's a little bit more of our zip codes that have that 70 that have reached a 70% threshold. But we still, when we take a deeper look at it, you know, they may be at 73, 74%. And there are other zip codes that are at 99%. So there's still some work to do. It's very specifically in our zip codes that are in our neck of the woods. And so these are what we were talking about in terms of some of the zip codes that we're looking at. One of our key goals was to 70% Black residents that are fully vaccinated. Then we were looking at the 13 to 17-year-olds that are fully vaccinated, right? Because we know for sure that is very important that a lot of our young people are vaccinated as well. And then we're looking for a third goal, 50% of 5 to 12-year-olds that at least have 1 dose. We know that this was a longer time for that age group to gain access to the vaccines. So it's going to take a little bit more to ramp up, but we definitely want to make sure that between those goals B and goal C, that the total amount of residents that are fully vaccinated is at least over 70% in many of these in our neighborhoods.
And what does TREE stand for?
That is the racial inclusive and equity zones. So those are very specifically those zip codes have a higher representation of Black, Hispanic, and immigrant communities. So this here is, we are looking at a trend, they're speaking to the trend of percent positivity over a 12-day period. One of the key and most important things that we're seeing is that most of the trends is decreasing. And I think we are all seeing that the number of cases that are occurring in various neighborhoods is going down. We are seeing before in terms of the percent positivity, sometimes this was in the high teens a week or 2 ago, and it continued to decrease as the Omicron wave. We're starting to see the back end of the Omicron wave. But what's also important is just the vaccination rates for some of these neighborhoods. As you see, we've seen that in some cases, we have at least 1 dose that's over 70%. We have rates for fully vaccinated for adults over 70%, as we were talking about. But you see it's all really in the 70% range. Nothing is in the 80% that they are fully vaccinated. So very important for us to recognize that. So work still needs to be done in terms of ensuring that other more groups get their vaccines. And this is what we're competing against, where 85% of all New York City residents, adults, have been vaccinated. There are certain zip codes that we know in the mid-90s. As you see, 10013, 1012, 95%. So there's still some work that needs to be done in terms of making sure that access and information is provided to encourage individuals to become vaccinated.
Stay on this slide for a moment, go back to it.
Sure.
Cheryl Miller is asking.
I think I can go up to this one. This one speaks a little bit more to some of the zip codes that you have in your neck of the woods, Steve.
Back to the other one. Yeah, this one. Cheryl Miller is asking about zip code 32. So Cheryl, it's the top line on this slide. All right, very good.
I know you said this is just for the people who are fully vaccinated with the 2 doses, but do you have any indication of how many have received boosters in these areas?
You mean the number of individuals
Yeah, or the percentage
that have that are the 2 doses?
that have received the booster? Is there any
Oh, the
information?
booster.
Yeah.
That I don't have the information. We're still in the process of capturing that data. I'll see how we might be able to add it on the next time I come in. I do know though that the booster percentages is definitely lower than the vaccination rates. So they can definitely be better. We also have seen that typically seniors have very low booster rates. And so that's something that we're definitely a little bit concerned about. And we want to encourage seniors to get the boosters and just being able to be supported by having access. Of course, some seniors that aren't able to travel the same way they were able to get the vaccination at home, that's also being offered for the boosters. But yeah, we have seen that the booster rates are not as high as the fully vaccinated or the adult does the adult rates.
These positivity rates are still fairly high there. I mean,
of course, like we know during the summer, at some point we are 2-3%. The city had put a 5% basically in terms of when we have hit a percent positivity rate of 5%, we will be trying to enact some measures to prevent exposure and spreading. But right now we definitely are working to try and get back down to under 5%. This here again just speaks to some of the, many of you may have seen that some of the work that's being done by some community-based organizations. There are some organizations that have been that the DOH is working with in terms of being able to get access to various neighborhoods. We are in a process of conducting RFPs and contracting with these community-based organizations. It's important what we basically, this is speaking to the fact that we recognize that we're not able to be everywhere, and sometimes it's even better for an organization that is known by the community to continue to provide messaging and support in terms of access and resources. So we've contracted many of these organizations, and these are some of these that we are working with. In some of your neck of the woods, we have the Black Health that is conducting some of these this work on 100 Black men of New York that is providing support here. And these are different funding mechanisms that the agency has. So that's why it's not everywhere that we were able to get funding to all community-based organizations.
Well, it probably goes without saying that we could use a Latino or a Dominican organization to help with this outreach.
Well, yeah, Black Health does have Spanish-speaking individuals that are working in that capacity, especially in the Washington Heights area. So although they may not necessarily be completely Hispanic-focused organization, they do have provide language support.
And that's the group, Steve, that Dave Crenshaw is working with.
I know.
One of the questions I had, looking at recent data, and I don't have it in front of me, it looks like the Hispanic vaccination rates have caught up, but we are still way behind on vaccination of our Black population
That's
throughout
correct.
Manhattan. What kind of special outreach are you doing to Black communities? And I know that this is a bigger issue in Harlem than Washington Heights and Inwood, but I'm curious what's your efforts to that.
Sure. So some of these organizations that we have contracted with, they literally are going out in various neighborhoods. They are on the street corners, providing resources. Some of them are providing messaging that they have developed that are speaking very specifically to a particular population. They are providing a variety of type of resources, KN95s, other PPE, just to engage, and then being able to be there to answer some of the questions. One of the things that we also do is community conversations. I was part of a community conversations with the Harlem Children's Zone yesterday for all of their advisory board, the parents that are on the advisory board, to speaking to them, answering the questions. There was a lot of questions around anxiety, taking the test, fertility. And so we're just engaging as much as possible. And then whether it's us or working with a community-based organization that is more well known by the community, we are just wanting to engage as much as possible. And that engagement is direct communications, messaging, provision of resources and PPE and supplies, and of course, just being able to respond to concerns and questions when they arise.
Great, thank you.
This is a little bit dated. I apologize. I know I was trying to get an updated one, Steve, and still wasn't able to find it. But one of the things that will be, we can get a link to is if you go to call the number 878-VAX for NYC or NYC mobile VAX locations, you'll be able to find the latest places where mobile locations are being set up. And I know this is a little bit difficult, Steve. I know we were talking about this earlier, that it's always best to have a consistent place in terms of being able to provide the vaccinations. And obviously it's something that the agency is looking a little bit more into, but recognizing that sometimes just being able to go specific to where individuals are at a particular corner is sometimes helpful as well. So this is one of the ways that we have been doing this. I just wanted to elevate this. One of the key things I think that we've often neglected is speaking about some of the treatment options. Of course, the best thing for anyone to do, the gold standard, is to get vaccinated and get boosted. But we also wanted to elevate the various other tools that are available to be supportive of individuals who may have contracted the virus. As you see, there are the antiviral pills. There are two different ones that have currently been authorized and available in the US for individuals age 12 and over. Of course, it's if you're tested positive, you're demonstrating mild to moderate symptoms for some amount of time, and you're at high risk for severe illness. It has the pills have shown to be very effective in reducing the amount of time or reducing the severity of the illness. Similarly, the monoclonal antibody treatment is something that's available. There's some organizations, some facilities that do it at home, but it's very important, again, that the sooner you are aware that you are sick, that the faster you're able to get these treatments, the better off it will be for you. So that's why we always suggesting that individuals get tested on a regular basis, especially if they're moving out, going around in the neighborhoods. But just wanting to make sure that these are two options that are available, and sometimes these are not necessarily spoken of in some of the healthcare facility settings. So it's on the patient or an individual to advocate for them on their behalf. We just want to make sure that individuals know about the antiviral pills or the monoclonal antibody treatment.
Well, but Padmore, didn't the CDC just recently determine that I don't know, was it 2 of the antiviral pills are not actually effective with the Omicron?
Not as effective, that's correct. With the Omicron, however, that's that particular variant, and is dependent on the variant that you may have. It's still effective against the Delta and the original strain. So it's still something that could be of benefit to an individual that becomes sick.
I thought the drug manufacturers took back the drugs and they're now off the market.
No, not all of them.
Oh, no, okay.
Mhm. I think there's a question by Sarah. No.
I don't know.
Any update on getting locations in northern Manhattan? And also my other question is, I know there's been a delay in some issues and not necessarily with city-run sites getting test results back. And a lot of people have waited weeks or they've actually just never gotten test results from some of these pop-up sites. And not necessarily the city sites, but other, it seems like there's a lot of vans on different corners. So I wonder if you
Yeah.
could talk about what's going on there.
Right. So no update really in terms of the return. I know there was questions around the 160th location. There hasn't been any determination about if and when that will be returning. We're still waiting for a decision on that. So unfortunately, I can't speak to that at the moment, but definitely, as I said to Steve, as soon as I hear more information, I'll definitely pass it on to him. For these pop-up sites, I'm seeing it. We've seen it a lot. Individuals that are providing a lot information about personal information that is given to these particular sites, and then they don't necessarily get any results at all. We're just asking that individuals really take a close look because sometimes these are fraudulent sites. And the best thing is to go to a pharmacy, to go to a hospital, go to a city-run site that you can trust. There are also, of course, the at-home testing that is being provided to individuals at the moment that they can request through the USPS. There is if you do find yourself having gone to one of these sites and it's taking 2-3 weeks before you to get your results, and maybe you don't never get your results, there is a website you can go to submit at least a claim to the fact that to identify it as a fraudulent activity. And I'll put that in a chat shortly. I just have to find it, but it will go to the Attorney General's office for New York State. And they will begin, they will reach out to you to get more information and just begin an investigation. We have realized and noticed that there's a significant amount of sites that are popping up and they're getting people's information and they're not providing test results after taking some of the testing that's being done. So we just want to make sure that individuals have a way of elevating that and to put these places out of business. So I will provide that link shortly.
Well, but Pauline, I believe, sent us that form last month, and I'm pretty sure that I sent it around to all of the committee members. But and actually, come to think of it, Catherine Diaz suggested that we post it on our website, which I should talk to Ebenezer about doing. We should make sure that that form is more readily available. Did you cover?
Yeah, I think that's it. For if there's any other questions, I'm happy to answer. But that's it for me, Steve.
You're going to send me the presentation, right?
Yes, Steve, I'm not too sure exactly how to submit or send it in the chat.
No. Attach it to an email.
Okay, I will do.
I would rather you do that. Okay, very good. All right. Did I miss anyone who wanted to ask a question?
I think there's a Legrand.
Yeah, Allegra, do you have a question? Yeah, she has a. Are we keeping up with repeat infections, breakthrough infections by vaccination status?
Okay. Yes, sorry. So, Yes, other countries, municipalities have started keeping up with infections by vaccination, booster status, repeat infections of COVID as a way to try to inform their local epidemiological models on, how, waning immunity and what percent has been infected and whatnot. And are the forms that we have, they're kind of standardized no matter what site you go to, have they been updated so that New York City can start to keep up with this information too? So that's one question. My second question is about the big news broke about city-run COVID vaccination sites for pregnant people on Gothamist. So has there been a retraining of your vaccination people so that they don't discriminate against pregnant women? Thanks.
So I'll just, to the first question, I cannot speak to that. I know that we're capturing a lot of vital information, very specifically in terms of some of the breakthrough numbers. I know those are numbers that we are looking at. As to when we will be able to start publicizing those numbers, I cannot say. As to at this point in time, I can definitely take it back and be able to come back with more information around that. I just haven't been as much with the epidemiology team as typically to get more information on that. For the in reference to the pregnant women, I don't necessarily think that for those sites that or those individuals, those places that may have been given that information, I definitely think there will be an opportunity for retraining and speaking to individuals about that. But the intent is generally the talking points has been that individuals who are pregnant, there has been demonstrated that or looking to get pregnant, that the vaccine is not in any way dangerous to the fetus, to unborn baby, or to anyone who's looking to get pregnant. And I think that's what most of the trainers will be doing. I think in some extent, individuals may have been a little bit confused about the latest information or just, misspeaking, but hopefully there will be a process so that everyone will be on the same page and speak to the fact that it's beneficial for moms, pregnant moms, individuals who are looking to, women who are looking to get pregnant, that the vaccine is of it's not a danger to them or their children.
Well, you're running commercials that encourage pregnant women to get vaccinated,
right,
that feature a pregnant.
So here's the thing, especially at some of the city-run sites, the DOHMH has contracted with third parties to run some of the sites. So, whether a talking point may have gotten lost or someone may have not been appropriately informed or trained, I think sometimes that obviously happens when you have a very large public health campaign. But the city is making sure that that information is standard across all its sites that it's running.
All right, very good. All right. All right, do we have anyone else? I don't see it. I don't see anyone else. All right, well,
okay, thanks a lot, Steve.
Thank you.
I will be back. I have taken some of the questions and I'll come back as soon as we get updated information on that.
Appreciate that.
Thank you.
And Padmore and I were participating in a call with various elected officials' offices earlier today. And I did get an offer from Assemblymember Taylor's office that if we have a site where we would like to have a mobile van for vaccinations, they could probably arrange for us to get one. So why don't we think about where we might like to see such a van stationed, and hope we might then be able to get one through the Assembly member's office. Okay. All right. Julio, thank you for agreeing to hold off on your report. Well, we're now up to you.
Okay, thank you. Thank you very much, Steve. Well, let me just say that, our community has gone through quite an emotional roller coaster over the last 10 days with the slaying of Officer Rivera and Mora, who were of this community. So I will be brief on my report. As of this week, the COVID-19 numbers continue to be better. We're seeing numbers, the numbers and the rate of infection on the decline. So of course, we're cautiously optimistic that we're going on the right track. So we continue to monitor all patients that come into the hospital upon admission for COVID. And as of yesterday, no, as a matter of fact, as of today, I'm sorry, we actually had 604 cases, COVID cases positive. This is in the healthcare system, Steve, not just up here. And that's compared to 825 of patients we had last week. So I don't have the local numbers, but the local numbers likewise reflect a decrease or a trend in the right direction. Also want to report that NIMIC tells us that the vaccine hotline has continued to receive fewer and fewer calls as we go forward. They are looking to see if they could transfer the number to the city for them to continue to monitor come April at this point. I know that one of the benefits of this hotline over the last month or so has also been to disseminate information around those tenants who are in arrears and how to apply for funding from the state. So it had a dual role over the last months or so. We also are concerned with, of course, 168th Street and Broadway, especially right across by the subway there. There's been a number of incidents there and by the DOH building, which is unfortunately not our building, but we of course continue to be very concerned about the safety of not only of our staff and our patients, but as well as our community members. So we continue to look at that and see what we can do to work with the MTA, the local police, and of course the community board to ensure that we have as much safety as possible there on 168th Street. Another note, just want to report that we do continue, at least the Community Affairs does continue to support some of our community-based organizations. We are happy that during the Martin Luther King, the Coach Dave and Team Dreamers have an annual Martin Luther King event. We were, glad to be able to support him and provide some PPE for distribution. We also had luckily found some additional coats that our nursing team had collected, and Team Dreamer and Dave provided those to local residents, which have came in handy during this inclement weather. And again, I just want to reiterate once more that we stand ready to support some of our community-based organizations that they need PPE or they need hand sanitizers, masks. They could please reach out to me. I'm at 212-305-9196, or you can email me at jab9029@nyp.org, and we will hopefully look forward to supporting some of those groups in our community that want to make some distribution to not only their members, but to members of the community that may need some of these safeguards. That's really it for tonight, Steve. And by the way, I just want to add, I'm not sure if Dr. Warning did report about his involvement and our involvement with the North Manhattan Agenda. There's a subcommittee on the mental health, which he has been very, very instrumental in working with, and it's really become a mirror of what WICOA has been, where all the senior groups do get together, discuss strategy, and share resources. So this has really become something similar to that. And I think, it's a great thing that he and Charlie Corliss from Iowa Community Services are putting this together, bringing together our mental health agencies to work collaborative and, find solutions to this very difficult problems. So thank you, Steve.
He mentioned earlier that every now and then I attend those meetings.
Once.
Last month, I think you told us that you were starting to provide vaccines. You were going to have a mobile van maybe outside the urgent care center at 21 Audubon.
There was a 21 Audubon. We had stationed a mobile unit that was doing the testing, the testings, and I'm not sure that we're doing vaccines, but that at this point is not we're shutting that down, so they're not there anymore.
Okay, and what was the? I got two more questions. What was the reference when you spoke about the NIMIC hotline? You said that something would happen in April.
So the NIMIC hotline is what I mentioned, is that they're getting a few calls, and NIMIC is looking and discussing with the city to see if that could be transferred to them so that they continue to monitor that.
So that people would call the city number to get an appointment to get a vaccine at Choney?
Correct. Yeah. Yeah, they will continue to monitor that number.
They would monitor you would keep the number.
That's what NIMIC is trying to is working on.
Oh, okay. All right. So nothing's actually been worked out. And
no.
When you refer to incidents at Broadway and 168th Street at the outside the district health center, are these robberies or something? What's going on there?
There have been some instances down on the subway where we had I believe it was 2 of our staffers the last year or so who have confronted incidents of violence down and robbery attempts. So it's it's not one of the safest stations that we have, and I think that we need to ensure that the police and the transit police and everyone work collaboratively or together to ensure that some of these incidents do not continue.
Well, as you know, the mayor and the governor announced that they were going to increase the number of police and the mental health outreach teams going into the subways. So I would hope that the hospital has been reaching out to try to make sure that that station, which definitely has a history of problems, especially on the lower level, on the number one, the platform, that it gets proper coverage.
Agree, Steve, and I think it has to be really a community effort, not just the hospital, but I think that perhaps folks that live around that area and also the community board can play a big role in advocating for that.
You're absolutely right. All right, are there any Sally? You have a question for Julio?
I have a comment and a question. The comment is just an add-on to his report, which is New York Presbyterian Chalk grant applications are open. They had a great information session at the end of January. So that's just to note for our community. And then in terms of COVID hospitalizations, do we have any sort of breakdown on how many hospitalizations were occasioned by COVID versus being incidental to the admission? And also how many of the hospitalizations occasioned by COVID were for vaccinated versus unvaccinated patients?
I will look. I need to go back and ask folks for that sort of breakdown. I do not have the local Washington Heights Inwood campus. So what I'll do is I'll look for those specific numbers for this campus and see if I could get a breakdown in terms of those who came into the hospital, diagnosed, found that COVID, as opposed to those who did not, just came in for COVID. So I'll find out what the breakdown is and share those numbers.
But Sally's second question is whether or not you might have statistics.
Right, on those who were vaccinated or not vaccinated.
Yes.
Right, correct.
Okay.
Yeah,
Okay.
Perfect, thank you.
sure, thank you, Sally. And thank you, Sally, for mentioning the chalk RFPs.
They did a great job as always.
Yeah, thank you.
All right, and you're going to get us the numbers for the COVID cases in the Washington Heights Inwood facilities.
Correct, that's, and attached to that will be the breakdown, hopefully, of what Sally had requested.
Very good, very good. Any other questions? Come on, Allegra, you must have a question.
Sally already asked basically the same question I asked the previous guest, like keeping track of cases, not just by, oh, it's a case check mark, but also like, was this person vaccinated? When were they vaccinated? Were they boosted? And from the hospitalization side, how incidental is the COVID status to them being in the hospital? I mean, there's this kind of slippery ones, like if you heart attack, was it COVID induced or not? Or is it some guy in there for, broken arm who happens to have COVID, right?
Yeah, well, I think you're basically reinforcing the Sally's questions. Yes.
Correct. Yeah.
So, okay.
Yes, Sally covered it this time. Yes.
Okay. All right, but all right. Sally, is that a new hand or an old one?
That's an old hand. It's an old hand.
Old hand. Okay. Well,
looks new.
It looks like it could be old. Okay. All right. Well, thank you, Julio. But stick around because the next speaker is interested in having you react to part of her report. So the next speaker is a returning guest, Diane Ashley, Chief Marketing and Communications Officer for the MJHS Health System, giving you the report for Isabella Geriatric Center.
Hello, everyone, and thank you for having me back. There have been a couple of changes since we spoke last time in terms of DOH requirements, and some of them address some of the things you were concerned about before. So regulatory is catching up with what we wanted to see. There's been a change in guidance about requirement for booster shots for nursing home employees. The governor's mandate now says that you must get the booster shot within 30 days of eligibility. Eligibility comes 5 months after your second dose of Pfizer or Moderna, or 2 months after your single dose of J&J. And if you're already eligible, you must get your booster by February 21st. So that's there. The vaccination status of our residents has really not changed very much. We're still approximately 90% of all residents are fully vaccinated. We continue to work on making those numbers better. The booster, just shy of 75% of our residents have received the booster shot. Again, we continue to work there, and we're staying at about 85%. So the numbers haven't changed very much since our last meeting. The other thing that changed is that DOH put in a requirement about visitors, and this committee asked about that last time. We were offering testing before people came into Isabella, but we were not allowed to require it. It is now per DOH, all visitors, including children, must show proof that they've recently received a negative COVID test result. If it's a rapid test, it must have been completed no longer than 1 day prior, PCR 2 days prior. We're not accepting home tests. And all tests must be done by a certified lab. If somebody comes and they want to visit, we are offering supervised on-site self-administration of rapid testing in the screening area so that we can make sure that nobody is precluded from seeing their loved one, but that we're making sure that we have safety. So I think we've seen some of the regulatory requirements add to the safety and security of both our patients, residents, and staff. So that's the Isabella update. I did want to share something, and this is probably on Julio's radar, so I'd just be curious what you think, but obviously wanted to bring this board into awareness if you're not already. In the fiscal year 2023 executive budget, there was a new provision put in that would require DOH to procure and limit the number of Medicaid plans servicing beneficiaries. That would be across the state. If enacted, the government's proposal would restrict the number of plans in each region to no more than 5 plans. Obviously, this would significantly affect choice. While the proposal seems benign, we'd like to sort of just address some of our concerns. There are currently about 5.5 million people in the state enrolled in Medicaid programs. As you know, these are typically people who are low income and have low financial resources. But we know, and many of you know as well, that many of these individuals are also at risk and have many multiple chronic conditions, many of whom need long-term care. Receiving that care in the community is obviously the ideal scenario. We are very concerned about the disruption the procurement process would cause for these very at-risk members of the community, as well as for the healthcare providers who care for them and the care managers who support them along the way. Procurement would create massive changes in how Medicaid beneficiaries receive their healthcare. Many patients have longstanding relationships with their providers and their support systems. And obviously, we don't see a value in breaking those important bonds. The burden of making fewer plan options available will fall disproportionately on residents of Washington Heights and Inwood. And it is anticipated that it will particularly affect communities of color and further increase disparities of care. Our shared goal, I believe, in this committee and for our community is to increase options, to increase services and choice, all with the goal of improving health of the residents in the community. And we believe that this proposal would unquestionably eliminate that choice. The state has already acknowledged that there isn't a financial savings associated with this. So we believe strongly, though, that it will take tremendous resources if the procurement process is put in place. And we believe that those resources would be better spent on the provision of care rather than on the paperwork and administrative work that this bid process would require. Specifically, we think those funds could be reallocated to paying for additional staff, more health services, and greater health care access for our community. Obviously, in addition to the serious concern for the well-being of our community members, we've spoken to many facility-based and community-based providers, and they seem to be quite concerned about this change as well. And we're interested in hearing what is the reaction of this community board, and not to put you on the spot, Julio, so feel free to not opine, but curious how our colleagues over at NYP are feeling about this.
Sure, thank you, Diana. To be honest with you, this is not something that I'm fully aware of. We do have, a couple of staffers who work on legislation and work on monitoring the state and some of the proposals. So I would circle back with them and find out what the thoughts are, and obviously share those with you.
Thank you, sir.
Yeah, it sounds very disturbing, obviously.
Very good.
I didn't know if I'm sorry, Steve, is that you?
Yeah, if you can, I wasn't able to take enough notes. If you could send me that statement, I'd appreciate it.
Absolutely. Absolutely. And we'd love to make more information available if this group would be interested, and obviously along the way, because there's a 2 to 3 month process here in terms of the budget getting approval. if you share our passion for this, we may come back and ask for the support of this group in fighting that proposal within the executive budget.
All right, well, it might be appropriate then for us to have a further discussion at our March meeting.
Sounds like a plan. Certainly not asking for it now.
All right, very good, because
Can you share, I guess, on the chat perhaps, or through Steve, your email, so we could talk this further?
Sure.
Okay, yeah, put it in the chat. If you don't get it for whatever reason, Julio, I can always send it to you.
Great, thank you.
And I think I have it too, Julio, because I think we were in correspondence when Betty passed. So
Oh, okay,
I can always send you a note with my contact information, but that would be great.
great. Yeah, let's have a conversation on this.
I got a very nice note from, I guess, Betty's sister out on Long
Carol,
Island.
probably from Carol.
Yes, yeah, very nice note. Acknowledging my contribution. I'm still hoping, Diane, we can do something for Betty at some point.
Yes, I think we still need to circle back and have a conversation about that. It's not off of our radar. It's just with the surge and everything else, it's been.
Understood. All right. Do we have any questions for Diane? All right.
Thank you all.
We're letting her off awfully easy. I mean, we're giving her the wrong impression of our group. Okay. Okay. Next, the woman from the Sanitation Department. Are you still with us? Ali Gumas?
Yeah. Hi, I'm right here. Thanks.
Oh, fantastic. I don't know how you ended up here, but I'm thrilled to have you. Because I got notes all over my desk, and I'm supposed to be calling sanitation to talk about how we can get the composting program back up and running in our community. So you're going to tell us how to do it, right?
Absolutely. I think I ended up here by mistake, but it seems like a good one. So thanks for having me. Hi, I'm Ali Gumas. I have been working on the curbside compost team at the Department of Sanitation for 3 years now. But I am also the acting manager of the drop-off composting network. So in addition to the brown bins, I can tell you plenty about the food scrap drop-off sites we have all over the city. I'll start with the brown bins, though. I know they're catchy. I know we've got the most questions for them. So as you've probably heard by now, we got some of our funding restored around Earth Day of 2021, and we're tasked with re-rolling out the brown bin program to districts that have previously had service, except this time we were doing it based on demand. So we pivoted to a sign-up model. Even if you had service before the pandemic, you have to sign up online or on 311 for your building. I will say I did mine. It takes about 30 seconds, but we're doing it for a few reasons. One is the brown bin program was heavily criticized before the pandemic for low participation. So we did not want to be running trucks down the street, adding to noise pollution, actual pollution, for the sake of serving the same amount of people. This time around, we're doing it based on signups, so we can take that list of interested parties and buildings and make a route that's more efficient. So maybe we skip some blocks altogether because buildings haven't signed up there. They can obviously sign up later. We'll reevaluate those routes once a month. And all in all, we're hoping this makes the program a lot more efficient and appealing to some people who were critical before. But more importantly, we're using the sign up model so we can actually talk to people. In the past, we have signed up buildings, given them bins, started their service, and then issues would come up. Maybe their bins would go missing or get cracked and they needed new ones, but they didn't reach out to us, didn't know how to reach out to us, or we didn't hear. So this time around, as people sign up, we have an email address. You have a customer service number that you receive. It's a great back and forth balance where you're able to tell us what problems come up. Maybe you're having doubts about participating, and we can help by visiting the building. We can provide more bins. We can send outreach materials, or we can do a site visit and talk your maybe building super through the process and help troubleshoot some of the common issues around the program.
So Ali, is it sufficient to first of all, what does it mean for a building to sign up? Do you have to have a majority of the residents sign a petition or some kind of fill out a form? Because I've been contacted by individuals from different buildings. They reach out to 311 or to Disney, and then they get a response back. Sorry, not enough people in the community are signing up, so we can't provide the service to your building. So so it's not enough for just one building in isolation to sign up. You need to have a core of buildings in a particular community.
Let me say that it depends on the type of building. So we see two main types. There's a low rise, and those are buildings with 1 to 9 units. So single family homes, multifamily homes, or small apartment buildings. In those buildings, we need one person to sign up. If you're one of 9 units and you're willing to participate, you're likely also responsible for taking that bin to the curb. So we're okay with that being an approved sign up. For buildings with 10 units or more, all the way up to 1,000, hundreds of units, we do require one sign up of an authorized rep. So that would be your superintendent, a board member, building manager, property manager, the owner of the building itself. Really anybody that has decision-making power in the building. We don't want to overstep boundaries. We don't want to have bins show up, but building staff don't know what to do with them. So that's just one of the fail-safes we use, so we don't get in murky waters and get a bad rep for just thrusting bins on somebody without knowing.
So I've been contacted, I believe he's the chair of his co-op board. So if he reaches out, he's an authorized rep, right? And he by himself would be able to enroll his building.
Correct.
Even though and he's got, I don't know, he's got at least 60 or so units in that building. So, and if no other building on the block enters the program, you would still service his building?
No, we're rolling out by community board. So it would be his building, but then any other building like it also in that community board. And that's how we would design those routes. So they're only with there. So for now, there are no trucks running in your community board.
Right, so
there's really high demand.
How many buildings do we need to have?
There's no magic number. It's unfortunate that our budget is the way it is because we're doing it by the most demand. So you don't need to have 10,000 people, but you need to have more than your fellow community boards. I think that is really intimidating for some, but I have a link I can send of the number of signups. It's on our website, both by units served and by number of addresses straight. So right now I live in a building with 200 units. On one of the graphs, it shows up as 200. On one, it shows up as 1. And that's just because we have a whole variety of geographic density. But Manhattan 12 is doing exceptionally well in both of those metrics. I predict you'll get service relatively soon. We've had really high demand. We're not currently expanding until the spring because we pivot fully to snow, but come maybe March, April, May, definitely we'll be expanding to new community board districts. And I'm pretty optimistic about yours. We have really had a bunch of large buildings come on, but generally just like thousands, we're in the thousands of people interested in your district. So to get you to that threshold, or maybe to guarantee it, because I'm not able to guarantee myself, like you will get service in April. I think it's likely you'll get service in the spring, but I can't say when. If you want to solidify that, you'll be the next community board. We need more buildings to sign up. And more importantly, we need more building managers, superintendents, staff to get on board because of so many high rises.
Have you got a flyer or something that we can email blast to people in our community to tell them that they have a chance to sign up and that we have a good shot of getting the service?
Absolutely. Yeah, I have a flyer. We have a small outreach team, but we've been doing outreach events across the 5 boroughs. We've talked to over 50,000 people in the last 4 months, which I'm really touched by today, but I don't have specific numbers, but we definitely have flyers available. We have digital flyers available. We're trying to put them up in storefronts, community centers, but we're also speaking as many places as we can.
And we need bilingual flyers.
Yep, I can do that. I've got in many languages.
Okay, I have one more question, and then I'm going to turn to a couple of my committee members.
Okay.
I think you mentioned early on that you're also involved with the drop-off locations. We had a location in the past at 157th Street and Broadway, which I think was actually maybe operated by Grow NYC, where they accepted food scraps. It was one of, I think, 4 or so locations throughout Washington Heights and Inwood where food scraps were being collected on designated days. At this point, I think we only have one such site at 181st and Fort Washington. Is there a plan to restore those other drop-off sites?
Yeah, you actually have 3 that are open right now. We've got the one at 181st. We've got one at the Inwood Green Market on Saturdays. And then there's another at Morris Jamel Community Garden, which is on 162nd Street. So I can send you full site details for those 3 sites also when I email you tomorrow. But you've got 3 right now, and we are continuing to work with Grow NYC and 7 other nonprofits that are working with us on these sites. So I'm hoping to have more in the next few weeks and months, but these are the 3 you have for now.
I'm sorry, I missed one of them. So there's one at 181st and Fort Wash. There's the Morris Jamel Garden, and what
the other one is at the Inwood Green Market, and that's at Seaman Ave and Isham. I don't want to mispronounce that. I'm sorry.
Okay. So, all right. But and what about my neighborhood at 157th Street?
Yeah, for now, that one's, I don't know the status of that one. I know that we're working with Grow NYC to restore many of the drop-offs they had pre-pandemic. So it's been a slow process. We definitely added a few dozen over the last few months, but mostly budget constraints, and we're just trying to make sure that we're spreading out new sites everywhere. So I'm hopeful. We also have a bunch more community gardens in CB12 that we're talking with, hoping to get some smaller sites popped up into as well.
All right. We don't have that many community gardens, but
yeah, I use that term loosely. Mostly, sometimes they are very small patches or nonprofits that work at other community gardens, or just most green groups that have any amount of of space to host a bin.
All right, very good. Okay, so we have 3 committee members. Catherine Diaz.
Hey everyone, hey Andy. I'm really happy and excited that the universe conspired for you to be here, because we've been talking about, I think, what feels like composting for a while, and the brown bins, and you're here. I have a couple things. So one, I think, and maybe some other folks might be feeling the same way, I'm really surprised, I think is a word, that there's thousands of signups in this neighborhood. Mostly only because I've only ever seen a brown bin once in my whole life living up here. Mm-hmm. And I think really similarly to other neighborhoods, there are economic, social, and different traditions and in waste management, right? And so, in terms of my side of the neighborhood, I had never seen a brown bin. And so I live in a building, for example, right, where Super still has to tell folks, don't put garbage in the hallway, yeah. Right? And so I'm curious, and maybe right now may not be the moment, but I would love to kind of hear a little bit more about your small and mighty outreach team. I know that, and I've read articles throughout the city in terms of what's happening in terms of engaging communities like the Heights that's really diverse in terms of working class communities. And, what's that outreach like? Any success? And then perhaps, in June, before we go for break, being able to see more or less, once the rollout comes out, what parts of District 12, right? Do we have pickups or drop-offs? And then second, which is really my big question, because I'm not sure how it works with hosting an actual bin, right? So when I'm thinking of the regular buildings in Washington Heights, what requirements from a landlord, right? If I am, let's say my case, where I want to have a brown bin, I'm one of the few buildings where probably the landlord still has an office here, but what I guess, what are the conditions that our landlords have to host, right? A lot of our supers either are lived in or are what's happening now is part of kind of part-time workers, or are kind of newer and aren't always here. So I guess, how do we kind of explain to landlords, what do they have to do? Do landlords, talk to you guys? It's a bit of loaded, but you get where I'm going.
Yeah, I can try. One thing I wanted to start with when you were talking about the distribution of where the trucks might be going within that community board. We've used a bunch of different words for it internally, but we found that people participating is kind of contagious. So you say you haven't seen a lot of brown bins, but we find that if one block has it, then the next one gets it pretty soon after, because usually they look over and they're like, huh, what's that? Or it takes one interested resident who like asks the question and pushes it forward. So we found that's definitely happens. So even if we get maybe some higher income pockets to start, once trucks are going to your district, we're really hopeful that our outreach team can help fill in the rest. We do bits of like door-to-door canvassing. We briefly paused that for Omicron surge, but we still have people's phone and email addresses when they sign up. So if you're a tenant in a 300 unit building and you signed up, but we need to get to your landlord or your building manager, we'll call you back and say, do you have their contact info? Now that's actually a part of the form as well. So when you sign up, if it seems like maybe you wouldn't be enough to get your building over the edge, we ask for the contact info right then and there. And then when we call them, when we email them, when we schedule a meeting, we don't say, Steve sent us. We say like, there is interest in your building, because we don't want to add to any bad dynamics within the building. We don't want to put anyone in the hot seat. But generally, I think we do talk a lot with building managers or superintendents. Maybe it's the caduceus, it's the logo, but I think as soon as we say, I'm from the Department of Sanitation, I think people listen a lot more than they would to their residents.
Okay. Yeah. And just to add to that real quick, in terms of the correlations, right, let's say with composting and like pests, right? Are there like educational materials perhaps that we can share with tenants? Because, you know, for obvious reasons, some supers may say, well, no, we have a huge rat problem in this building. And even neighbors may say, no, there's too many rats. I don't want to have like everybody's garbage, you know, smelling up in the basement. So yeah, how do you guys respond to that?
Totally. We get that all the time. Just like off the cuff, I always say there's no new trash, just new bins. So you asked like what it takes for a building to sign up, what it would take for the landlord or the building staff. And actually, I like to think that it's in most cases not additional work, right? Sanitation provides these free bins. That isn't true for recycling. They have wheels and they latch shut. So if you think about it now, you're setting your garbage out once a week or twice a week in black plastic bags. If you do have a rat problem, they're likely getting chewed through. Those rats are still getting a meal. And then when the sanitation worker hauls the bag on the back of the truck, some litter comes out, right? It's bad overall. So usually that part is a pretty easy sell, because we say, would you like these free bins? We'll give you as many as your building needs. And then your staff no longer has to haul these heavy bags, and instead they can roll something out. So it's safer, but also definitely better for the rat population. They'll ask us for data. We're working with DOH on it, but also working with them on their rat academy, so we can help message this out as a solution when people are concerned about the rats in their neighborhood. Because just no data, common sense is it is harder for them to chew through a thick plastic than it is for a thin plastic bag. As far as outreach materials, yes, we have them. We have them available online for download or order if we have enough in stock. But every single building that gets added to a route automatically gets sent some outreach materials. So one is a poster that says, your building has service. Your brown bins are located blank, because some buildings will put them in a lobby, in a basement, in an alley. You know, it looks different in different places. So we want to make sure that everyone knows that you have service instead of just the 2 people who signed up. Similarly, we have stickers that you can see like what goes in this bin. At these food scrap drop-off sites that are community hosted or hosted by Grow NYC, we can't take meat and bones and dairy, but in the brown bin, we take everything. So anything that goes on your plate, meat, bones, dairy, your coffee filters, your napkins, pizza boxes, we can take it and we can turn it into compost. So I find that's often a lot easier. I know recycling is like, well, this bottle, but not this bottle. With compost, it's easy. If it goes on your plate, it goes in your brown bin. So that's pretty fun messaging. Also, we offer like actual outreach. So if you're worried about your building maybe not getting the message, I can present, my whole team can present. We have different languages spoken on our team, so we're able to present in different languages. And we have all those outreach materials in different languages as well. So if you get everything, if you get this delivery of like 15 posters in English and you write us back and say, actually, can we have this in Arabic? We'll send that over too. So I hope that answered all of your questions.
Yeah, thank you.
Okay.
But I gather the landlord does not have like the right to veto this or stop it. Is that what you said? That's what you implied earlier, is that all you need are tenants to sign up. Is that correct?
No, in a building of 10 or more units, we don't just need tenants. We need a board member, a building manager, a landlord. We need somebody in that role. So it is unfortunate. We definitely have a large portion of the buildings that have signed up are buildings that are waiting for that special approval. We chip away at it. We make those calls. We send those emails. We do presentations or visit the site beforehand, but it can be a slow process.
Right, so in a building of 10 or more units, you need the landlord or the property manager's approval.
Or a superintendent. That's often, I find it makes more sense to go straight to the superintendent because those are often the people who are dealing with the garbage themselves. So it would make more sense for the person who's rolling it out to the curb to be the one to sign up, but we'll talk to whoever we can get.
I think often the super is not going to do it on his own or her own. They would want to get the okay of their property manager or the landlord. Tanya, you're up next.
Yes, thank you. Thank you so much. And just as a disclaimer, I'm not responsible for what Tupac is saying in the background in case you can hear him. Okay. Not responsible for that. It's just plain. But I wanted to say, I think, that this is great. And I think definitely this is something that's people need to be doing. My concern is that about how, keeping with the education thing, like I think there's going to be a need, an attitudinal change in some cases about this, because literally, I'll be standing at a curb and people will drive by and throw chicken bones right out the window after they finish eating it.
Yeah.
And so there's definitely some education and attitudinal changes. And even with the supers, as Steve was saying, but I think supers sometimes they take a position of hear no evil, see no evil, say no evil. And they're not going to want to, try to force that upon people or even try to be responsible for it. So I don't know if that's the solution. And then what kind of buildings will be able to participate? Some buildings, honestly, people are working like 3-4 jobs and things like that. The last thing on their mind is like, oh, I need to compost.
Yeah.
And I'm just saying the reality of it is it's a privilege thing. So like the Maslow, hierarchy of needs. I'm worried about eating and keeping my lights on. I'm not worried. Composting is up there at the top. The self-actualization top, where I can now think about all these other higher order things, but I'm trying to survive. And so how are you going to address that? How, because I think it's deeper than just, we're going to do some outreach. We're going to know it's attitude changes. It's how do we overcome people who just don't have time, that this is not their priority. And then third, I know you probably already do this because sanitation, I'm sure you already do this, but with the schools, have you thought about integrating this as a school activity with some of the schools so the kids, when they start younger, can start to appreciate this and not end up like mommy and daddy throwing chicken bones out the window? How do we, engage little kids so that your bins are there and they can have a little project while they're, engaging in this?
Yeah. Definitely. I especially, let me do schools first. Every public school in Manhattan receives composting. So they, at the very least, have the opportunity to learn in school because they have those bins that they see and they have the separation available to them already, which is part of the thinking and expanding to schools before we expanded to residential, is because we can get that behavioral change in as early as possible. I totally hear you on the hierarchy of needs, and it's definitely something we've come across. Personally, at work, I am always advocating against us using the environmental argument to compost. I think it's a good one, but I think everyone who knows about it is already convinced and has already signed up. And I think some of the arguments that I make in favor of composting that speak to beyond the environmentalists, of which I obviously am one, but what talks to real New Yorkers is often the problem. Is ease, is public health and safety. I think rolling the bins instead of heaving bags, that people hear. They don't hear, let's worry about the methane emissions if they're really busy and overwhelmed. But hopefully they hear, okay, I want fewer rats. Like, great, let's swap out some bins. So we've definitely had success that way. I also think there's a financial incentive right now. It's not direct, but I don't know those of you who were around in New York City in the 80s and 90s when we were rolling out recycling, but sanitation used to provide free recycling bins when we were first getting it out citywide. We don't do that anymore because we couldn't possibly keep up with the demand of 8.5 million recycling bins. But we do right now offer free brown bins. So I think that's also an appeal, is we're heading in the direction of mandatory, right? I don't have a timeline. I wish I did. It's not going to be tomorrow. But eventually I think this will be widely accepted across New York City as something they have to do, even if they don't want to or understand it. And we see that with recycling too. It's everywhere. There are fines associated with it, and we still have problems getting people to do it. It's part of the outreach. It's part of the teaching children young. But hopefully with composting, there's an incentive to get in before there are fines. There's an incentive to get in while the bins are free. And while we have the outreach team we do to go and make these presentations, give supers hopefully like we take an hour of their time, and then hopefully it saves them time and money down the line. We're hearing from buildings that have service that they don't have to clean out their chutes as often. The garbage chutes, if you have one of those in your building, it's food waste that often messes it up the most. If they don't have to clean them once a year or once every 6 months, that building is saving thousands of dollars. That can affect rent, that can affect maintenance. So hopefully that those are some of the arguments that I can make to people. And I do when I get to talk to them about why to participate. Sorry, I think that was a much longer answer.
Yeah, no, thank you. Thank you so much.
Sally Fisher.
Yes, just to emphasize the point about supers. The one super that I've had extensive conversations with that was part of the program before was very enthusiastic about the program because of the chute issue that you mentioned, the fact that it has actually made his job easier because it's sort of cleaner disposal sanitation. I wonder if there's a way to recruit a super to educate other supers in neighborhoods about what the benefits are to a building.
We are actually currently working on something that we're calling super supers.
Oh, good.
So yes, I mean, if you have somebody, I'll send my email out, and I'd love if you want to connect me to anyone else that we can add to this list. But we're doing either brief interviews or just getting a testimonial in writing so we can advocate from that perspective as well.
Great. And at one point you had a subway drop-off program. Is that going to be reinstituted, or is the community compost drop-off sites its substitution for that?
I wouldn't say substitution. There are some like commuter sites. I think of one immediately in Queens. I know that doesn't help you, but they're not off the table. We're doing both, I guess is my short answer.
Great. Thanks.
Aren't those the sites that I was referring to earlier?
Yeah, I think Sarah just said that the subway station versus the green market. I think that's a small distinction, but it's the same model of we're taking it away at the end of the day. It's not staying on the garden.
Yeah, the one at 157th and Broadway was like in a little triangle right across from the subway entrance.
I know it well.
Oh, do you really? Oh, okay. OC, you're up now.
Yes. Okay. I have two questions. One, we currently have 10 compost bins in our co-op, and we would like to keep our compost in. We don't want to give it away if we don't have to. So when and if this program become mandatory, how are we going to work it out? I'm not sure. Specifically, because if the cities take all food scraps and we don't, we only take the food and, you know, the fruit, vegetables and stuff that are compostable pretty fast. How are we going to do that? That's becoming like really complex for us. My other question is in terms of local law 97 and the reduction of emission in 2019, there was a conversation of including the food, the trash that we are hauling out of our buildings and as part of the calculation of emission. Mm-hmm. So do you have more information about that? I know that it was just in conversation in 2019 and COVID happened and it's probably everything is on hold, but I just wonder if you have more information about that. I'm really interested to know where are we at that.
Yeah, let me start with your first one. In terms of, it sounds like your building's composting on site and that's awesome. And no, I will say I'm optimistic about eventual mandatory, but I don't think it's going to be anytime soon. When we do, I can't imagine that a building, I imagine it would work in a similar way as recycling. You know, maybe don't hold me to this if it's 5 years from now, but you don't get fined for not having a bag out. You get fined for having a bag that has the wrong things in it. I think that's likely going to be true for food scraps. So wow, I can't even imagine a future where we're fining for not composting. I hope this is eventual, but I think it would have a similar model. Otherwise, it wouldn't leave room for the several small but mighty buildings that do compost in their yards or alleys.
All right, very good.
What about local law 97? Yeah.
I don't have any more information. I think you're right that COVID probably put an end to a lot of those conversations. But I think with the new class of council members, I'm highly optimistic about some sort of composting legislation.
Keep us posted if you find out anything about it. Thank
Absolutely.
you.
Thanks.
Well, she'll be coming back to us on a regular basis now to keep us updated.
Whatever.
Of course.
Now that she found us. Do we have your contact information?
I put my email in there, but let me take one of your emails. I'll just email you everything I've said today. And that way you can invite me back when you want me.
Is your email in the
it's at the very end of my first message, but it is just a Gumas. My name is on the screen at dsny.nyc.gov.
I'm going to email you tomorrow or tonight, and you'll respond.
Perfect.
Will you also be starting up, or have you already started up your compost giveaways?
No, actually, that's a part of our budget that's still not existent. What we have been doing throughout this year and last is that nonprofits with the ability to pick up compost, they can pick it up from Staten Island. We're doing small 1 pound giveaways right now, but those large 40-pound bags are still on hold. Our fiscal year ends at the end of June. I'm pretty optimistic that they'll come back, but they're not here yet.
Great, thank you.
Sally, you disappoint me that I was convinced you were going to say something about how the Food Council wants to participate in composting.
We do, but that's a separate conversation.
Okay, all right, very good. But I think when she talks about community gardens and getting other people involved, the Food Council would be a perfect place. If we could link her up, if she's not already linked up with the Food Council.
Yes, I will actually take your email and contact you regarding the work that we're doing in Northern Manhattan.
I'd love to hear it.
Okay, very good. Sally will be a very good resource for you. All right, thank you very much, Allie. I'm so glad that you stumbled into our meeting, and seriously, I would like you to come back every now and then and keep us posted. And I'm gonna want to stay in touch with you. Thank you very much.
Yeah, I'll definitely come back when service starts, and maybe before then if you need. I'll talk.
That was great. Thank you so much.
Thank you. Come every month, please.
All right, very good. Okay, old business. I sent to everybody the latest report from DEP on service requests for the month of January. There were 180 such requests from people in Washington Heights and Inwood. This time around, noise was not in the top 3 or 4 positions. There were 20 requests for lead kits. Noise. There were also 20 complaints about noise, construction before and after hours, and 15 complaints about leaks, and then 14 complaints about noise from alarms. I also sent to everyone the latest report from DDC on the gas main and the water main replacement project going on in Washington Heights in the 180s and mostly in the 180s. It extends a little bit into the 170s and up to 190th Street. That project is now at 94% completion. So it shouldn't be much longer before it's completely done and all of the roadway restoration work is completed. There are no updated cleanliness ratings on streets and sidewalks. They have not been posted on the Office of Operations website. OC, do you have old business?
Of course, my $1 million question. Textile recycling. Any update about when they're coming back? And if they are back in some of the farmers markets, can we find out which one of the farmers markets has those the program is back in operation? I meant to ask, because it's really I really don't understand why they're rolling it out so slowly. I don't understand why we are not the first one to get it back. We need it the most.
You know, I certainly have some clothes I want to get rid of. Allie, is there any chance that you're familiar with the textile recycling program?
That's so funny. I was just noting it in my follow-up right now. I'm not familiar with the textile recycling at farmers markets or that process of returning them. I know it exists, but I don't know about the progress. But sanitation we've resumed expanding our apartment program is what we call it. And it's for textile and e-cycling for apartment buildings. So your building has to be 10 or more units. It has to get a similar approval from your building management super or somebody, and you get a bin that fits in your basement or lobby or wherever and stays there. Once it gets full, sanitation collects it. So I can add that note for how to sign up for that in my follow-up as well.
Very good. Well, I've been in touch with Grow NYC to talk to them about about reviving the program at the various green markets. So I will, I'm overdue in contacting them again. I keep promising OC I'll do it, and I haven't gotten around to it. But
I thought they are back in operation in some of the markets, not all. So can we get a list of where are they in operation? So at least some of us that can go and schlep those things to the market can do it.
have you checked the Grow NYC website?
I did not.
Okay, well, I gotta believe it's on their website. If not, I'll ask them for the list. But
all right.
Let's check their website. But the last time I spoke to the woman in charge of doing the outreach for the green markets, she said it was only reinstated at a limited number of sites. All right. Under new business, there's another brownfield cleanup plan for another site at 207th Street and I guess 9th Avenue, 401 West 207th Street, which is probably that site right next to the bridge where they're putting up that large scale apartment building with
where the gas station used to be.
Yeah, but with Mad Equities. So again, there's a deadline of I believe February the 18th. So I forwarded all the material to the committee members. Please try to review it. And again, if you have any suggestions on comments you think we should submit, then send them over to me because I'll try to have it. I'll try to run it through the executive committee if necessary in order to meet that deadline. Any other new business? Is that Ms. Fisher? Sally?
Sorry, the $10,000 for the NYC cleanup initiative, which is to be directed to graffiti removal, trash pickup, etc., has come across in the city budget to Community Board 12. We were awarded as a post-budget allocation $10,000 from Councilman Rodriguez's office, and it came up at the executive committee, and I think the expectation was that this committee, which discussed it in the past and recommended e-waste recycling, would formalize that recommendation and present it to the board. So I just wanted to discuss that. And then one idea, I know we've had e-waste recycling in Inwood. We were talking about a Washington Heights site. And I also thought that in Inwood, we should do not only the Inwood Farmers Market, but the same day do a satellite site at the Dykeman houses so that it's also available to east of Broadway residents. And I know the last time they were planning pre-COVID to do the e-waste recycling, I had arranged with Lower East Side Ecology Center that we could do a satellite site at the Dykeman farmhouses, and Friends in Woodhill Park would do the marketing and the outreach to the Dykeman houses. But I just wanted to discuss that today and figure out what we needed to do to get the money allocated and approved by the board for allocation to e-waste recycling.
Are you saying that the money is now in the community board's budget?
Yes. If you looked at the treasurer's report, the councilman allocations went from 8,500 to 18,500. So that information, you can't get it if you do the lookup site, but the money is there.
All right. Well, as I mentioned to you, I think after the last meeting, or maybe it was after the executive meeting, I did speak to Christine Dance Romero, the head of Lower East Side Ecology Center, and she was supposed to get me like a one-page proposal. So let me get back in touch with her. Frankly, I was hoping that we would do one e-waste collection in the lower heights, another one further up in the 180s, and then keep the one at the Green Mark at Isham Street. But maybe there's a way to work it all out.
Great. And I think our big challenge in Washington Heights is just doing a lot of outreach through the community board.
Absolutely.
I think the reason they canceled that site was that they didn't have the drop-offs that they had expected.
Absolutely, yes. Yeah, last time we tried it, it didn't work out. Catherine.
Yeah, no, that's what I was gonna say, because I mean, I just also want to keep in mind timing, because I remember also talking about having like 2 for 2, both sections of the area, so folks don't have to drag their stuff. But given that we have to spend by June, we're in February, we present, next month, hopefully, or this month. We want to be able to have sufficient, as much time as possible. So I think just one makes sense. That'll give us 2 months, 3 months tops. But yeah, I was gonna just suggest that, like, if the group that would ultimately be leading the event can just send over the numbers, and that's what we can share. And I think once they send that, if you can send it by to like via email, Steve, because I think this is something we can work over email too. Like Sally, I think it's a great idea to think about the partnerships, and even they're gonna roll out the composting in the spring, so why not also invite also that team up to that event? So just thinking that what other partners we can have at this event, and I think we can add that on via email.
All right. All right. Well, let me see what I get from Christine, and I'll get back in touch with everyone. All right. Any other new business?
I just wanted to mention the email that you sent from the conversation you had with Carmen. It would be great if she would allocate more money to sanitation pickups. And generally the council members do that out of the NYC cleanup initiatives. They allocate a substantial chunk of that money to Disney, and Udonis has allocated less than most of his fellow council members, but hopefully we can encourage Carmen to allocate more.
Oh God, you just warmed my heart. Thank you for bringing this topic up, because I meant to bring it up, and the idea that you actually read my emails is also heartwarming. So I had a very good conversation with Carmen. Carmen is going to take it sounds to me like she's going to take a completely different approach. She herself said that she wants to allocate substantial money to the Sanitation Department itself, that she realizes that we need more pickups for the trash receptacles, especially on the commercial streets, and that she thought that allocating the money to some of these community groups, while it may have been well-meaning, may not have been the best use of the funding. So I think she's going to do. I think we're on the same wavelength with Carmen.
Great. And she is coming to the Parks and Cultural Affairs meeting next Tuesday, and it might be worthwhile for us to invite her to one of our committee meetings. Her new chief of staff, James Burke, is actually a fellow community organizer and outreach coordinator for WEACT. So I think she's going to take much more of an interest in the environment than our former council member.
Yeah, but Emily may know him from WEACT, although he may have left WEACT. I don't know when he left WEACT. It could have been a few years ago. Allegra.
Thanks, Steve. Yes, so while we're talking on the topic of trash, I don't know if I mentioned every time I'm here, but 9th and 10th Avenue in Inwood They're both pretty gross. I don't know if they ever get their trash picked up. Yeah, I mean, if we can have trash picked up in once in a blue moon, that might require coordinating with the police, because there's a lot of like, you know, fly in the night body shops and whatnot along 10th Avenue, but there are people trying to get around there too. There's a bus route that goes underneath the subway tracks. And 9th Avenue is so disgusting. I don't even think it's passable, even though they're moving all those schools over there. So it would be very nice if they cleaned up ever.
So you're talking about between
The
Dyke
9th Avenue between 201st and Dykeman, and 10th Avenue along the subway yards in particular.
Oh, yeah.
So 207th to where it runs into.
All right, so that's 10th Avenue north of 207.
Yes, and 9th Avenue, 207th down to wherever it peters out. I guess that's around 201st or Dykeman, or it's a weird little, I think it's 201st.
Yeah. Okay.
That's also where a lot of the illegal car washes operate.
There's a lot of fly-by-night operations, but you know, when my husband and I, sometimes we try to walk down that way, but there's a proliferation of trash, and then there's like dead animal debris, and then there's like cars parked on the sidewalk in various states of like put togetherness. But it's supposedly a city street.
Yeah.
It's pretty gross.
Yeah.
It would be nice if it was cleaned up. The other thing, two things I want to talk to you about were, one, I've asked you before about Department of Health, as we come back into warm seasons, monitoring for Lyme disease or at least tick prevalences in our city parks. And then the third thing, my colleague Christian Bernayan, he had that nice piece in City Limits about urban heat island block by block that covered Community Board 12. And I know you guys have been in contact, so I don't know if you've set a date for I forget the woman he works with, her name, but from Columbia to come and give a talk about urban heat island in our community.
That really sounded interesting. Tell me his name again.
My colleague, you've emailed him. His name is Christian Bernayan. I mean, he is not a unicorn. He is a Black man in a field that's probably 99% white. So he's pretty incredible. He's won all kinds of awards. This particular study, they had like routes, like they had, I guess, people, I don't know if they were only in vehicles, but they also were walking, and they're just going street by street and trying to validate and inform some of the satellite products to show like what urban heat island is like. And it's more significant, I think, than I was expecting in Inwood. Like you kind of feel like Upper Inwood especially should be really sheltered because of Inwood Hill Park is so big and we're surrounded by water. But the valley, like Broadway and East, is quite hot, and it's like a big urban heat island. The whole Inwood, Washington Heights gets even bigger, redder heat island in Central and East Harlem. Yes, it would be nice to have a discussion about that and ways to mitigate against it. So.
And WEACT has done a fair amount of work on that. In fact, last week hosted something on disaster preparedness, and a lot was talked about with heat and solutions to the heat problem. So maybe when we have him, we could also have someone from WEACT.
Oh, it would be great. That emergency preparedness seminar, I went to that also. It was great. It would be good in general to tell what do you do like when you might have a power outage because of an extreme heat day, like those kinds of planning, which the community board would be the obvious vehicle for getting that kind of information out.
So Sally, did that disaster planning meeting already take place?
Yes.
Yeah, I think it was like 10 days ago, maybe.
Oh, shoot.
It was good. It was like a workshop. It's like they came, they said, let's talk. And then you broke into groups of like 6 and you talked like, what if this scenario, what if that scenario? What if, we've got about to get a storm surge? What if we have a day over 100? What if Con Ed says it's going to be rolling blackouts? How do you protect your community, protect yourself?
I'd like to get a presentation about whatever comes out of that meeting as well.
Yeah.
All right. But do me a favor, Allegra, tell me one more time Christian's last name.
Branayan, Branneon.
Hold it. B-A.
BRA, Branayan, Neon. Branayan.
B-R-A-M is in Mary.
No, in like Nancy.
Nancy.
You guys have emailed. I know you have his email. I've seen you do it back and forth.
No, but I got like hundreds of emails. Okay.
I will reply to that email chain because I know you guys talked about maybe them coming in February, but something didn't happen, so it would be March or April.
All right.
And I have a question, Steve, when you're done. I have a comment too when you're done.
Okay, Tanya, go ahead.
Yeah, I just wanted to say, as this committee begins to delve a little bit more into environmental issues, and I know Steve will be a great leader through all of this, but I want to say, just what is going to be the plan? I think it'd be good for the committee to decide what their goals are around this, and maybe that could be an agenda discussion, like what are our goals overall in terms of environmental? What are the things that are priorities and goals before we set out? Because I think that's going to be very important to have a focus, but then also I want to make sure that any discussions about these things or topics that we are including less privileged voices in these conversations, because environmental personally is very, 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 very homogenous in terms of the voices that are there and the people, speaking on these issues and the priorities that are set. We looked at remember the hurricane that we had here, and those people who were in illegal basement apartments died, in illegal basement apartments because people in certain, economic conditions or whatever are not really included in the conversations about plans for or even needs in terms of our environment and our infrastructure. So I just want to say that it's very important because it's so easy to, not have those voices and not have those people at the table to sort of really help steer the otherwise it's going to get steered in a different direction that's not really addressing some of the real issues that some of our less privileged people in our community are facing and need. And it's a problem. And I wanted to be inclusive of other organizations, not just one, but there are many other organizations, that are involved in these things and that, might have different perspectives or, different insights for us. It's just something that I think would be concerned because it's so easy to really go in that direction. I see it happen all the time. And it's one of us to be cognizant of that we are making sure that we are, centering other voices as well. And when we start to delve into these issues, so it doesn't become like 99% of the rest of environmental discussions or efforts become very homogenous. Hope that was helpful.
That's really important, Tanya. I dropped Christian's information into the Q&A so that you can see who he is. And I do know that as far as environmental justice is concerned, the climate research community in Uptown Manhattan generally engages with WE Act. And I think in different boroughs, there are other environmental justice groups that we principally engage with. But if there are other ones, let me know and I'll try to get that word out too. Tanya, I just don't know of the other big groups uptown besides WE Act.
Yeah, sometimes it's not even just an organized group. It's a group of citizens and community residents who have been, looking into these issues and trying to do this work. And they don't have the funding or the resources because to actually do more formal work in that area. So it could be, it's a mixture of all of that type of stuff. And that's what we found out in Detroit. The money was being thrown at certain environmental groups and they weren't doing anything. And the people who were being impacted didn't have any funding or even a voice or a platform. And then you had the dirty water poisoning people for years. So, I just think, it can happen very easily. And that's been my issue with, environmental is that, lack of inclusiveness and engagement and in that, and it easily slip into that where these voices become the loudest, and it's like, but and then we end up like we ended up in Queens with people dying when people probably knew that was a threat to people's safety and well-being. But when people are not engaging with those people, and these discussions are not taking place until 11 people are killed, including children, that's not what we want. So I just think it's very important that we, think about that and make sure that doesn't happen.
And the extreme rainfall piece, I think in general, the climate scientists in New York City, because we have so many ocean waterways surrounding us, have really thought pretty hard about storm surges. And so when you hear them talk about flooding, most of the time they're thinking about storm surges, and even like the New York City flood mapper. It's all like hurricane related wave action storm surges, and the extreme rainfall events probably haven't got as thorough of a treatment as they need to get. And when I go to these kinds of things, I tell them they need to pull those two pieces apart because it is that very real threat to people living in basement apartments and whatnot. So yes, those are great.
You got people in NYCHA don't even have any heat. What about that?
I
You
mean,
see what I'm saying? I'm all for all this other stuff, but we got people who don't have heat and their landlords not provided. And this is what we don't talk about. This is what I mean. Like, I don't even want to talk. Okay, because my building has heat. And I know how, and I have certain privileges to ask for what I need, right? So I'm just saying, bring these voices in and let us talk a little less, right? And let them talk a little more.
So Tanya's got a great point there.
That's
about
what I'm saying.
This is the health and environment committee. Maybe we should take a count on how many building complaints we have in CB12 about inadequate heat, and because that puts buildings at risk for electrical fire. Aside from it being just horrible for the people who live there. Yeah.
Right. And, why people should have to use space heaters in the first place. It's outrageous that people have to even use them. All right. Well, we have a lot to think about. It's 9:25. Do I hear a motion to adjourn?
Motion to adjourn.
All right. All right. We'll be back at the same spot next month, and hopefully we'll have Langen Engineering to discuss how they've been able to, what techniques they've used to remediate the brownfield at 4650 Broadway. I'll make another effort to try to make sure they come. All right. Thank you all. Thank you.
Thank you, Steve. Thank you, everybody. Thank you, Allegra, for the insights. Thank you.
Okay, thank you. Thank you, Allegra.
Thank you. Julio, I sent you